Women are less healthy, more stressed, poorer, and angrier than they've been in years. That's the finding of a new survey on the state of women's physical and emotional health that represents 94% of the world's female population. Part of the reason is the pandemic, which paralyzed the global economy for over 2 years, but it also coincides with a dramatic rise in authoritarianism and increasing neglect of women's issues. On October 26, the Washington Diplomat and Dutch ambassador André Haspels co-hosted a half-day event at the Royal Netherlands Embassy in Washington, D.C. The focus was the 2021 Hologic Global Women's Health Index, which graded 122 countries and territories on a scale of 0 to 100. For the second year, Taiwan scored the highest. Latvia and Austria came in second and third. Others in the top 10 included Denmark, Estonia, Switzerland, Germany, the Czech Republic, Israel, and Norway. Dr. Susan Harvey, Vice President of Worldwide Medical Affairs at Hologic, explains why the 140-page report is so crucial to understanding the global healthcare disparities.
This survey is unique because it's a comprehensive look at health, as well as listening to women and their healthcare experiences and perspectives. So this data will contribute and be used in collaboration with other standard data sets, which are not from the perspective of women and a bit more challenging to gather the data.
Surprisingly, the United States ranked 23rd in women's health, behind South Korea, Mauritius, and even Malaysia. The worst-scoring countries when it comes to women's health were Lebanon, Turkey, Venezuela, and the Republic of Congo. Dead last was Afghanistan. Roya Rahamani was Kabul's ambassador in Washington until the Taliban overran her country last year and removed women from all public spaces. As a result, she said, Afghan women don't even think of their own physical or emotional health as a priority anymore.
Mobility is restricted. So in the places that, or in the villages that women cannot even walk to whatever clinic that might be still available and possible, this situation has extremely exacerbated, and the situation has gotten dramatically worse, as it has been demonstrated by the report.
According to the survey, more than 1.5 billion women worldwide lack screenings for cancer, heart disease, diabetes, or sexually transmitted diseases and infections. Barriers to preventative care contribute to widening gaps in women's well-being across high versus low-income countries, urban versus rural areas, and more educated versus less educated women. COVID was also a major setback, says Esme Chombo, the Washington-based ambassador of Malawi, one of the world's poorest countries.
Women's health is a very big issue, and after the pandemic, I think it has got more challenges, because what I've realized is that some of the reserves that had been put aside for women's health had to be used in the issues for the pandemic. And so we need to go back to the ground and start planning all over again.